Welcome to Bariatric Surgery Orientation. I'm Dr. Amed Bariatric, your bariatric surgeon. The reason we're here today is because you or someone else thought you could benefit from some help, and because you feel ready. Today we will discuss our philosophy of wellness, that health is something you create and change through daily behavior and choices, as well as using medications and procedures as tools of that change. I'm Dr. Amed Bariatric, your medical director at Amed Bariatric Surgery. I'm a board-certified general surgeon that takes care of things like bowel obstructions, sick gallbladders, cancer, gunshots, and car accidents. I also have a special passion for obesity management, for which I completed a fellowship in minimally invasive and bariatric surgery. I'm originally from nearby Georgia, and I've been a practicing surgeon in this area, Anderson, for over a decade. Let's talk about obesity, now one of the most pressing health concerns of our time. Being overweight affects people of all ages and incomes in all parts of the world. It's been increasingly common in our lifetimes due to changes in food types and availability, as well as changes in activity preferences throughout life. Obesity negatively impacts the function of every system in the body. Oversaturation with food adds physical strain, physical volume, chemical stress, and widespread inflammation. This increases the work of every breath and every heartbeat. Excessive adiposity compromises energy management in the liver and pancreas, causing type 2 diabetes and promoting liver failure by creating resistance to the hormones and other chemical messengers produced by the body to regulate itself. Physical and chemical strain results in heart disease, cancer, deterioration of joints, and onset of other serious health conditions. Function of the body is disrupted chronically, and early death and debility become more likely in obesity. The good news is that substantially reversing obesity, like a person might expect from gastric restrictive surgery, is a potent solution. Able to put many health conditions into remission with high probability, extending life and reducing health risks and physical dysfunctions. By correcting obesity, people typically live longer and with fewer ongoing healthcare costs. Most importantly, patients report profoundly improved quality of life, reducing discomfort and increasing ability to live fully and more normally. Normal weight people better enjoy life's routine and recreational activities. Bariatric surgery is one of the safest major medical procedures. Despite the often serious health conditions of our patient population, over the decades it has evolved from what was once considered a last recourse in the unhealthiest of people to a routine corrective and preventative elective procedure in well-optimized patients teenage to any decade of life. All procedures are performed using minimally invasive approach with incisions just smaller or just larger than a centimeter in size, offering reduced pain and immediate return to activity. Most patients are walking the day of surgery and home the following day. There are increasingly effective medications for appetite suppression and obesity management. However, gastric restrictive surgery continues to be the mainstay of effective treatment in patients with severe obesity and severe associated health conditions. Medications alone remain insufficient to reverse obesity in the majority of patients, especially those with already severe obesity. A person with a body mass index over 40, such as 5'7" and 254 pounds, will qualify for surgery based on weight and medical risk alone. Patients with existing severe health problems, such as heart disease, sleep apnea, or diabetes, qualify at even lower body mass index of 35 and above, such as 220 pounds at 5'7" or 254 pounds at 5'11". Appropriate candidates for surgery have well-optimized medical conditions and good compliance with prescribed medications and treatments. They are as mobile and active as they're capable and are psychologically fit to take on new expectations, instructions, and change. Any chronic or acute mental health concerns should be adequately treated with medication, therapy, healthy coping mechanisms, or the resolution of contributing stressors. Everyone experiences difficulty in life, and surgery can be appropriately timed around life events. Most patients will become candidates with indicated treatments. Most people have probably heard of gastric bypass surgery, an operation that treats not only obesity but powerfully remedies other conditions such as acid reflux symptoms, gastric emptying problems, and diabetes. It can be a great option for patients without extensive prior abdominal surgery, with known hiatal hernias needing repair, and diabetics with gastroparesis or just suboptimal blood sugar control. The operation is performed by separating the stomach into a small pouch at the top, which provides the sensation of fullness after a mere few bites of food. There's reduced hunger and almost no acid or bowel reflux possible after separating the rest of the stomach. The pouch empties into a connected division of small intestine, which is also reattached further down to deliver digestive secretions from the pancreas and liver to the ingested food. Any types of food may be eventually tolerated, and the patient experiences rapid weight loss over many months' time. Appropriate candidates for this operation do not use tobacco products, do not have substance or alcohol dependence, and must not afterward use frequent or high doses of NSAIDs like aspirin, ibuprofen, naproxen, Mobic or Celebrex, and others, as any of those would increase risk of non-healing ulcers. Also, patients with any form of bypass operation should always have a relationship with a bariatric surgeon wherever they live, in case they ever develop a bowel obstruction from scar tissue or internal spaces created by the loss of fat in the abdomen. The most popular operation for gastric restriction is simply a smaller stomach without reconfiguring the intestine. In a sleeve gastrectomy, by removing 70 to 80% of the stomach capacity, patients similar to a gastric bypass feel full faster and have reduced hunger. The divided stomach is removed from the body, leaving a narrow pouch with the original outlet, and food passes through the entire digestive tract. Similarly to bypass surgery, a patient will rapidly lose weight over many months, often tens of pounds per month early on. Sleeve gastrectomy has a very low risk of long and short-term complications, and patients do not have increased risk with vice or medications. However, this operation does nothing in particular to improve reflux symptoms and does less to help gastric emptying problems compared to bypass. Restriction of the stomach alone can create worsened or new reflux symptoms that require medication or occur in spite of it. There's no one best operation, and patients will have different goals of health and wellness and different things they're treating. Your surgeon will help you in the decision-making process to decide which operation might be safe, feasible, and effective to help you meet your goals. Duodenal switch is an operation with features of both sleeve gastrectomy and intestinal bypass for malabsorption. It is the most aggressive of all bariatric operations and is typically reserved for extremely obese patients or those with poor glycemic control despite the use of insulin, or those that have insufficient weight loss from a prior sleeve gastrectomy. In this operation, the pouch is the same as the sleeve, but a bypass is performed just past where the stomach would empty into the intestine. The majority of the intestinal surface is bypassed, leaving just a few meters of intestine to interact with the food and absorb it. This helps patients manage weight who are less good at making appropriate food choices, however with increased risk of other problems like malnutrition or diarrhea. It may be performed as a single-stage operation or years after a prior sleeve gastrectomy as a revision. It is most appropriate for patients who do not have severe reflux symptoms, who might be better off with a gastric bypass in that case, even if they had prior sleeve gastrectomy. This operation may be performed with 1 or 2 intestinal connections depending on patient preference and insurance factors. Revision bariatric surgery is performed at AnMed to address weight recidivism or regain, undesirable symptoms, or complications from previous bariatric surgery. Individual risks and technical factors can be discussed with your surgeon to determine if you're a good candidate. Reflux and abnormal swallowing symptoms are a consideration for any patient undergoing stomach surgery. Sometimes your surgeon will want to perform flexible endoscopy to assess these symptoms as part of the decision-making process when you decide which surgery is right for you. Prior gastric surgery or known abnormal anatomy, such as the presence of hiatal hernia, would also be indications for endoscopy and other diagnostic evaluations. It's not uncommon for patients having bariatric surgery to undergo other necessary procedures at the same time, such as hernia repairs or takedown of scar tissue from previous operations in the abdomen. While immediate complications of bariatric surgery are mostly preventable and avoidable, certain measures must be taken to ensure patients are the lowest risk of adverse events. You may be placed on antacid medications to reduce the risk of ulcers and irritation. Patients are usually given compression devices for their legs at the time of surgery and injections of blood thinners to reduce risk of blood clots in the legs or lungs. Your surgeon will advise a 2-week low-carbohydrate diet before surgery to shrink the liver and reduce the risk of damage and bleeding and create a working space to enhance the technical safety of your procedure. Performing procedures through small incisions reduces risk and severity of wound infections and to reduce risk of abdominal wall hernias, which are very rare regardless. In extremely overweight individuals, preoperative weight loss may be advised and sometimes required. Nutritional deficiencies are rare in patients that take vitamins and minerals as advised after surgery, while their consumption of food is insufficient to meet their needs for micronutrients without supplementation. And some surgeries have more risk of malnutrition than others, though the overall risk is low. Maintaining adequate nutrition and avoiding unhealthy habits and prohibitive medications and vice are the best way to avoid long-term complications. Some patients may still experience unpleasant symptoms despite doing everything as advised. Pain or vomiting every time with eating and drinking or any kind of bleeding is always a concern and should prompt you to see your surgeon. While incisional and internal hernias are rare, up to 10% of bypass patients will experience some type of problem in the long term, maybe even years later, that requires a surgeon to manage. And patients should always be aware of where the nearest bariatric surgeon practices, in the office and hospital settings should they require emergency care. Dehydration is the most common problem bariatric patients experience shortly after surgery. Patients can also experience routine illnesses after surgery just like anyone else. And especially if hydration is compromised, be sure to notify your surgeon for assistance. It is important to expect that eating and drinking will change significantly following bariatric surgery. Drinking at the same time as meals isn't possible with a small volume of stomach. At first, patients will struggle just to maintain adequate fluid intake and then should focus on meeting protein intake goals to maintain muscle mass, as they primarily expend body fat for energy. You literally breathe the weight away. Just 1 to 2 weeks following surgery, most patients will tolerate a variety of soft, high-protein foods. Some months following, patients will move on to vegetables and fruits in moderation, which is a balanced diet appropriate for weight loss in most people. Extraordinarily active patients may require some starch intake to maintain athletic performance. However, most will continue to minimize refined carbohydrates during the weight loss phase. All patients should avoid foods high in saturated fat, refined sugar, alcohol, and liquid sugar calories such as juice, milk, sweet tea, soda, and other sugary drinks, as these would sabotage weight loss even after any bariatric surgery. Physical activity is the most important thing anyone can do to maintain health. A few weeks after surgery, most patients can tolerate some amount of exercise, and with progressive weight loss, patients should increase the intensity and duration of efforts of routine, almost daily exercise to expect continued weight loss and to achieve maximal functional improvements. Patients not routinely exercising after the first few months will see significantly less desirable results. Even our best efforts do not always produce the results we're expecting, and that is okay, because there's not one correct weight or size or health for everyone. The expectation is that you will give your best efforts and we will give our best guidance. And if you're seeking more assistance or camaraderie beyond your surgeon, dietitian, and other staff of the bariatric department, we also offer patients a patients-only support group for only those in our program, so that you can seek assistance from or share experience with others who have common experience, advice, and help to offer. Thank you for listening, and if you heard something that appeals to you and think that you're ready, we're here to help you on your journey to better health and living. We're Amed Bariatric Surgery, and I'm Dr. Amed Bariatric, your surgeon.